Hi all, welcome to Oet Speaking. Today we discuss an Oet roleplay. Here the setting is a gastroenterology clinic. You are the nurse who works at the clinic. You see patients after they undergo tests at the clinic. Now you are talking to a patient who has been diagnosed with irritable bowel syndrome. The patient is not sure about the condition and needs advice about treatment and management. Task: find out the symptoms she experiences, type, duration, frequency. Find out any triggers she may have noticed. Stress. Explain about IBS, not clear cause. No clear cause, either constipation, diarrhea, or both. Intestine probably oversensitive at times. Outline treatment options, medication, diet changes, explain about stress management, yoga, meditation. In this scenario, you are a clinic nurse and your patient has been diagnosed with irritable bowel syndrome. As per the task, we need to collect the history and presenting symptoms, explain about the condition, causes, and treatment options. Keep the scenario in your mind. Here, this setting is gastroenterology clinic. So we can start our conversation by saying, "Good morning. My name is Sarah. I am one of the registered nurses working in this gastroenterology clinic. How may I address you?" Here, let's assume the name is Miss Maria. Then we can ask question like, "Okay, Miss Maria, I see that you have had some tests at this clinic, is that right?" Then probably the patient may tell you like, "Sister, I had a colonoscopy procedure earlier this week at this clinic and the doctor told me I have some problems with my bowel. It's something like irritable bowel syndrome. Actually, I'm not sure about that condition. Could you please explain, sister?" Then we can say like, "Alright, Miss Maria, I believe that you have been diagnosed with irritable bowel syndrome and you need some information about your condition. Is that right?" Then we can reassure her by saying, "I understand how difficult it must be. Try not to be worried. Definitely, I will explain everything in detail." Then, as per our first task, we need to collect the history of patient and after that explain about IBS and its treatment. So we can ask questions like, "Before proceeding further, I would like to ask something regarding your symptoms. Is that okay?" After that, we can ask questions like, "Could you please tell me what's been happening with your bowels?" Probably she may reply like, "Sister, I have several episodes of abdominal cramps and diarrhea. It's been very embarrassing, sister, because I keep passing wind." Next question we can ask like, "How long have you been experiencing this problem? How often do you get these symptoms?" Then you can ask question like, "Miss Maria, you told me that you have cramp-like pain. So how do you rate your pain on a scale of 0 to 10? Here 0 is no pain, 1 to 3 is mild pain, 4 to 6 is moderate, and 7 to 10 is severe pain." These questions you can ask one by one. Probably the patient may reply like, "Sister, it started 3 months ago and I have had bouts of diarrhea and constipation and it's really painful when it happens." Now our first task finished. Then as per the second task, we need to find out, is there any stress in her life? So we can ask questions like, "Have you noticed anything that triggers your condition?" Or you can ask like, "Is there anything different happened in your life?" Probably she might say you like, "Sister, I have noticed that it was worse a few months ago, as I had a lot of stress at that time and I started a new job which is highly paid but very stressful." Then we can reply like, "Alright Miss Maria, this may be one of the reasons of your increased symptoms Because of stress, you cannot relax, so it will affect your bowel. Try not to be worried. I will explain how to overcome the situation. Is that okay? Probably at that time the patient may reply like, sister, I have had IBS, irritable bowel syndrome before, but I don't know much about that. I thought it meant that I was allergic to fiber in food. Then we can reply like, alright Miss Maria, I will explain about irritable bowel syndrome. No, Miss Maria, actually it has no clear cause. But this happens when your intestine become oversensitive. Then the smooth muscles become overactive. This causes problem like spasm, cramps. Sometimes you may have constipation. Sometimes you may get diarrhea. Sometimes you may have both. Are you following me? Then, as per the interlocutor's card, she may ask you questions like, is there any medication available? Do I need to follow any medication? At that time, we can say like, alright Miss Maria, there are medications available to relieve your symptoms, and I understand that doctor has already given medication. Please take it on time as prescribed by the doctor. Other than that, you need to follow some dietary changes. So it will be really beneficial for you. Then sometimes patient may ask you question like, what dietary changes I need to follow? Otherwise, we can ask question like, Miss Maria, could you please explain about your dietary pattern? Probably she may tell you like she is having a busy schedule, so she don't have time to take breakfast on time. At that time, as per our task, we can explain like, Miss Maria, it's really important that you make some changes in your diet. This can be done by avoiding high fiber foods and gas producing foods like cabbage. Don't worry, I will give you the leaflet which contains a list of high fiber foods and gas producing foods. Is that okay? After that we can say like, also it's very important to eat regular meals. Make sure you have breakfast, lunch, dinner on time. If you skip your meals, this may cause flatulence that will aggravate your symptoms. Are you following me? Now we have one more task. So we can ask questions like, have you ever tried yoga? Or you can advise directly by saying, you can give some suggestions to relieve her stress. And say like, okay Miss Maria, along with this, one more thing I would like to recommend is to manage your stress. You told me that you started a new job which is very stressful. So it would be better if you could do some activities like yoga, meditation and gentle walks. It will help you to relieve your stress and relax yourself. I know Miss Maria, it's very difficult to manage with your busy work schedule. But for the sake of your health, please try to do that. Do you think you can able to do that? Probably the patient may agree with you. Then we can wind up our conversation by saying, do you have any other concerns? If there is no other concern, we can wind up by saying, once again I assure you that if you follow dietary and lifestyle modification along with medication, you will be better soon. If you need any more help, you just call at any time. This is my number. Thank you, Miss Maria. Get well soon. In this way, you can end up your conversation. Thank you.